Cool. Okay. Hi everybody. Like Carrie said, I'm Charmaine. I am the Assistant Director for Scatterside on the West Side. Um, and I'm gonna do motivational interviewing. So this training is usually super interactive. So there'll be a lot of like questions I'll ask. There's a couple of well, a lot of activities that we'll do together. So as I'm going through the PowerPoint, feel free to like unmute yourself and just ask a question. Usual motivational interviewing trainings can go for like days. Like DMH does theirs like 2 whole separate days. But I'm gonna try to give folks a good foundation here for a couple of skills that we can use with our clients. But if things like don't make sense or whatever, feel free to reach out and in the chat or just unmute yourself. We can go from there. Okay, so I'll just start slideshow. Cool, perfect. So can y'all see my presenter view or the regular slideshow? I just need somebody to tell me which one they can see.
Regular slideshow.
Okay, perfect. Perfect. All right. So I like to start with kind of giving a framework to when motivational interviewing was created, what the time frame was, what was like going on, just so that we're aware of like the implications. So motivational interviewing is considered an evidence-based practice. So I'll abbreviate that as EBP. And what that means is that it is supposed to be the best research, clinical expertise, and it takes into consideration patient needs as well. So EVPs result in the best patient outcome. It's an umbrella term that covers any evidence-based practices in all fields. So social work, dentistry, medicine, all fields usually have an EVP. I think, well, the reason why I mentioned this, I'm sorry, okay, is that this EVP was created in the early 1980s, right around the beginning of the crack epidemic. A lot of stuff going on that time, and it was created to really for that population, for folks who were using substances and on that kind of cycle of change. So I like to be clear that this research team that created this also wasn't inclusive, right? It was 2 white guys. You think about the population that was using crack in 1980s is going to be folks of color. So just be mindful that that whole dynamic of who's the researcher and the research subject comes into play in this stage. There are like adaptations to this that kind of go over like cultural competence way to do MI. But just be sure to think about like the biases that would have been embedded in the creation of MI and how, we have to be mindful that not all of these skills is going to work for every community. And with us understanding each community and each culture, then we know how to apply what intervention and et cetera. And we'll go through like examples of how like in certain communities that it may not work right. So the goals of MI is to explore and to really understand the client's interest and consider their consideration to make changes in their own life. We also will talk about like why clients might be ambivalent to change. Another goal is to elicit change talk, which is a really specific term. And we'll go over what that means as well. And then you want to another goal is to help a client plan for and begin making those changes. You also will enhance a client's confidence to change. And then noticing a client's success as they move forward is a super important goal of MI as well. So the stages of change in a nutshell. So MI comes into play when someone is like thinking about changing any part of their life, right? So it could be like, well, I think I want to move out of this neighborhood, but I'm not ready. Or I think I want to stop smoking cigarettes, but I'm not sure. Or I'm so sick of spending my money on, I don't know, pens, whatever. So if someone is wanting to change, that's These are the stages that happens, and MI, you use that within these stages. So the first stage is pre-contemplation. So maybe someone's not yet considering change, they're not willing to, they're not able to. The second stage is contemplation. So people will see the possibility of change. They may not know like how to do it or not all the way sure, but they're in that like contemplating stage. The next one is determination. So they're like, okay, I'm going to do this. Don't know how to do it, but I'm going to do it. The next one is action. So there's active steps taking to change, but it hasn't necessarily stabilized the change. So maybe someone who's smoking cigarettes has started wearing patches, but still smokes like 1 cigarette a day, right? So they haven't totally changed. And some days they smoke more or less, but they're actively trying to change. The fifth stage is maintenance. So you have achieved those goals and they're working towards maintaining that change. So in the example of someone not smoking cigarettes, maybe at this point, they're not even using the patches anymore. They're just not smoking cigarettes, and whatever helped them to stop smoking, like therapy or whatever, that's what they're continuing to do. And then the last stage is recurrence. So, maybe a stressor happens and they go back to what was comfortable for them for years. I will say that the stages of change are not a linear process, right? You may have a client you see one day and they're like, no, I don't want to stop. Leave me alone, right? And then another day they go to like, well, I'm already doing this, and this, and blah, 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 right? So you can go from 1 to 6 or 2 to 5, right? It's not a linear process. So tasks that you want to do within each stage constantly is just continue to raise awareness, right, about what's going on, what they're doing, what you see them doing, which is always great to like let a client know, like, I see how hard you're working to not smoking cigarettes. Like, I see that. You want to help resolve some of that ambivalence. You want to help identify some appropriate change strategies. You can also help implement those strategies and kind of learn what potential reoccurrences, what that may look like. And then you also are helping clients develop new skills for maintaining that recovery. And then you're also helping clients cope with the consequences if that happens, because that's a part of the process, right? Like, it's like when one of us wants to like work out and it's like, oh, I'm going to work out 5 days a week and I'm not going to eat Wingstop. And then something happens and I'm going to Wingstop, right? So that's the same thing, right? Like, it applies to any type of change that you're trying to do. All change is going to be like a process. Okay. All right. So a quick overview, or just, I guess we'll stop here. What do y'all know already about a motivational interview? What have y'all heard, or, all that stuff?
I've done like a motivational interviewing training before, but it's a while ago. So I know there's like a distinction between, I'm not sure if it's the right word, but like change talk, and then like I think they call it sustained talk, or like something like that, where they might like speak in a way that is like reinforcing like the habit that they want to break, or like something like that.
Yeah. It's a part of it. Has anybody else heard anything about motivational interviewing?
Yeah, I've heard motivational interviewing compared to being a mirror. So we don't put any of our own opinions or biases, just reflecting back what they're already stating, but making it in a way that's like a soundboard so that they can hear what they're saying too and then strategize from that. Yes.
Who was that? Who was it?
That's me, Michelle.
Michelle. Okay, cool. Thank you. Okay. I like to pick on people. So Michelle, you are out of the box already because you spoke up. And who else spoke up? Lillian. So we'll pick on other people today. So y'all are definitely right. The change talk is all in it, right? We are like sounding boards. None of MI comes from us, right? Like, we're not saying you should do this and that and that. No, it's really allowing clients to see what their motivation is and helping them to see it too. Like, this is what I'm hearing you say. Do you realize that you're saying that? Do you realize that it sounds like you're really motivated to, you know, not smoke or stop eating Wingstop, whatever. There are 4 main components. So just as like a heads up, a lot of the main components have like acronyms. You don't have to memorize the acronyms because you'll get the PowerPoint and all that stuff, but that's just the easy way that they help people to like put it together. Okay. All right, so just to get into like what they call the spirit, right? So if you're feeling like this client is talking about they want to change or something that's going on that's like really harmful to them or anything like that, you want to understand the spirit of MI so that when you're practicing these interventions, you understand like the framework and how they should be presented. The spirit in the acronym is PACE, P-A-C-E. The P in PACE is partnership. So the relationship has to honor the client's perspective and their experience. We have to be able to provide and create a space that is not coercive to change, but is conducive to change. The A is an acceptance, and there's 4 pieces of things you have to accept. That the first one is absolute worth, right? That everybody has worth. You got to trust them. You got to believe in them just because, right? Because everybody deserves that. The other part to accept is you have like accurate empathy. And that's really like having an effort and an interest to understand their perspective, even if it's different from your own, like really trying to understand their framework of how their mind works and what their view of the problem is. The other piece to accept is that we have to like support their autonomy. So we hear, you know, we talk a lot about like self-direction, right? So the client is free to change or not to change. Even if they have said every day for like a month, I want to stop, blah, blah, blah. It's still their choice not to change. And that's fine too. And then the last part you want to accept is the affirmation piece of it. So you want to seek out and acknowledge the client's strengths and their effort. So the C is compassion, which is just, you know, kindness, a caring and willingness to help others. And then E is evocation, which is really just getting clients to talk, right? Like evoking stuff or like words and conversation out of them, because you want to, the more you evoke information out of them, the better it allows you to like understand where they're coming from, what they're feeling, and all that stuff. Okay. Any questions so far? Okay. So the next component is RULE, R-U-L-E, love their acronyms. So the R in RULE is resisting the writing reflex, which is that thing where we say, no, you can't do that. That's right. That's wrong. What do you all think? Where do y'all think this comes from?
Well, I don't know if there's anything specific, but I know that urge from me comes from like wanting to help people and feeling like I'm imposing what I think is right for someone else, even though that's not necessarily the best situation.
Mm-hmm. Yeah, that's exactly it, right? That usually when you want to tell somebody what to do, it's because you like want to help, right? That's exactly what it is. But I think there's a way to, well, MI and what I think TPC as a whole believes is that there's a different way to help without us telling clients what they should and shouldn't do. In acknowledging that it comes from a place of good intention, right? So the U in RULE is understanding the client's motivation. So you want to use your curious lens to ask, and what that means is like just saying it really just like that. I'm so curious, like, what does that mean for you? Or can you explain that a little bit more to me? I just want to understand it a little bit better. Just opening that door and allowing clients to explain and talk about whatever makes sense to them. The L is just listen, right? Just listen. I think a lot of times when we sit with a client and they're like, sometimes it can be all over the place and talk about 20 different things. And you're like, oh, I need to connect them to this. And we got to do this application and they don't have an ID. And, you know, this is their new unit and their lights aren't on yet. And you have all these things you want to get to. But sometimes it's really important just to sit and like listen and don't be in your head about like what's next, right? You just want to sit and listen and hear what they have to say. And then the E in rule is empower and encourage clients. When I say like empower, it's not that like we're giving them that power, right? You empower somebody by believing in them, believing that they have ideas and they have the ability to change. And that's when they find their own power. That's how you do that empowerment piece. Okay. So the 4 processes in MI, you'll see this come up a lot, right? Like these are the stages in every step of the way, in every skill. That this is kind of how the stages of change is all kind of connected in that way. So in the beginning, you're really just trying to, like the L in rule is listen, right? You want to listen and engage with clients, seek to understand them, and communicate your understanding to them. And then the next part is like focusing, right? So a client can have like 3 different things they want to do and they talk about all of that. And then you want to focus into like, okay, this is what the client feels like is most important to them. And this is what we're going to work on. And then the next part is, okay, now that we've figured out of all these things, this is what is important and this is what we want to work on. Let's talk about like why this one, right? Like why is this important? Why now? What your reasons are? How's it help? How's it not helping you? And just draw out a little bit more about the specific task or specific issue. And then the end of it is planning. After you have a good understanding of what the problem is, how long it's been around, how many times the client has maybe tried to change, all that stuff, you want to focus in and figure out a way to get that, right? And this is very similar to that stages of change circle that now you've gotten to. This is probably right around the time where the client is in the action phase. Okay. So someone, I think Lillian, you mentioned this earlier, change talk, which is very specific to MI. You probably won't hear it anywhere else. So change talk is a type of speech that we want to hear from clients. It's so super, super important in that, in the rule it says listen. Sometimes we aren't listening and they're talking about wanting to change and we're not hearing them, right? Like we're not absorbing that they're like, I'm so sick of spending my money on unhealthy food. Oh, ding, you're sick of it, right? Let's work on that, right? Like that's the stuff that sometimes if we're moving too fast, it blows right by us. So a couple of you, whoever wants to unmute themselves, give me an example of when you heard a client in that change talk, right? That you kind of understand them wanting something to be different. What have y'all heard from clients?
I had a client who told me he was tired of spending all his money on alcohol. He was tired of drinking every day. He was tired of hanging out with his buddies and drinking all the time.
Okay. Yeah, that tired of, when somebody says they're tired of something, that's it. That's right there. Anybody else heard something from a client that's like, maybe they want to change this?
Today, a client mentioned that the reason why they lost their previous apartment was because they were partying too much. So that, that they don't want to be living in this situation again. So there's this type of job that they're thinking about applying for.
That's a good one too. And maybe they don't say it directly, but they say that like their behavior caused some like negative consequence, right? Yeah, that's a good one. One more? Does anybody, heard a client say that something they want to change?
I'm getting backlash. I've had a client talk to me about they're getting a second chance on a new apartment. And this time they weren't gonna invite the same friends to the apartment that they would hang out with before. So just wanting to change your environment.
That's a good one too. Like, this happened last time. I'm probably not gonna do that again, right? That's them wanting to change that behavior. That's a good one. So in change talk, you always want to make sure that the clients are making the argument to change and not us. We can support clients by, reflecting and articulating what their reasons are that they said, because they may not even realize, you said you was really sick of this, and we talked last week, and you mentioned the same thing. And then I know a couple months ago, we also talked about how it just, doesn't allow you to have money for A, B, and C or blah, 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 right? So us putting that together for them is like, oh, yeah, I did say all of that. And it's the stuff that they're saying themselves. You always just want to show that to them in that way. Okay, so we're taking a little stop here with a little stop sign. What situations, just from understanding the framework and the conversations you may have, what situations sound right to use motivational interviewing in, and what situations may we not want to use MI in?
I mean, it may not be appropriate to use like motivational interviewing if like the change talk that they're like using is like about a goal that is like maybe unreasonable or like too lofty for him. Then like it wouldn't be like a good idea to like encourage them on something that isn't gonna like go well or something that isn't practical for them to act on in the moment.
Yeah, like if it's like a 10-step away thing, maybe we start at the 1 step, right? And break it down a little bit smaller. What else? What's another situation that might not be? I think mainly, I think there's only one, and I'll just be clear about it. It's kind of like a trick question. So if a client is like in a crisis in that moment, right? They're talking about harming themselves, harming somebody else. We're not going to use MI, right? Like, because MI says you want to like draw out goals and draw out a conversation. In crises, there's usually direct questions you got to ask client, and you're trying to bring them out of that moment. You can always revisit that, right? Like, you were in crises, what led up to that? Was it connected to this issue? Was it connected to blah, blah, blah? But if they're in the middle of crises, especially if you're doing like a suicide assessment or a homicidal assessment, we're not going to use MI. There's very specific things we want to get in that meeting to get them safe, right? So just to be clear about that one. Okay, so now we're gonna move into the last component, which are like the basic skills. I have to stop sharing. Carrie, should I stop and then start again with the recording? Or pause it?
Yeah, okay. All right, you can
Okay.
pause it.
Okay. It was really loud. I'm sorry, y'all. So y'all could see the open-ended questions, right? Y'all can see that? Okay, thanks. Okay. That's not where I want to start with. Sorry about that. So we'll talk about open-ended questions and then we'll go into that. Okay, so these are the 4 basic skills that we're actually going to go over. There are lots of MI skills. There's like a whole book. Like I said, usually the trainings are a lot longer than 2 hours, but these ones are good, really, really good foundation. So another acronym is OARS. So the first letter in OARS is the O, which is the open-ended questions. So can somebody tell me what, like, why are we specific about open-ended questions? What do they do?
They allow space for more than a yes or no answer.
Mm-hmm. That's exactly it. Yep. They get information, they right, and when we say information, just like the person just mentioned, is no, yes, or no's, right? Like we want like a meaty answer. We want like them to tell us, even if it's a 10-minute explanation, right? We want that in an open-ended question. It also allows us to understand somebody else's view. We have some examples. So this is going to be an activity for, for everybody to join in on. So we'll go through each question. Y'all can put in the chat or mute yourself. We'll go through each one. Is it open or closed? If it's closed, then we're going to open it as a group. So the first question, what is the last grade in school that you were able to complete? Is that open or closed?
Close.
Close. How do we open this one up?
What is the highest grade?
You want to put it in the chat? How do we open this one up? What is the highest level grade you completed? Let's open that one up a little bit more, because you'll probably get a one-word answer, right? I went to 12th grade. Oh, that's not a one-word answer. 12th grade, right? So let's open it up a little bit more. You're on the right track, though.
Can we say, do you think people should stop going to school after high school?
What would be an answer to that? How do you think somebody would respond to that?
It can be either a yes or a no, but it can be a reason after.
Okay, so let's pause here. Let's open that question up, right? So we're trying to understand how people feel about school. How do we open that one up? Because you're right, you can't say yes or no. Sometimes, usually if you start a question with do, they'll say yes or no. But if you want to know their reason behind it, what can we ask somebody?
Michelle had a good response in the chat.
Okay. I feel like you can also say, tell me about your past education. Tell me how you feel about your educational goals, maybe.
Yeah. So you could put, I feel like, tell me, right? Tell me about, that's like the perfect way to open up any question, because it's just like, well, just tell me about it. They may say like, what do you mean? Whatever that means to you, right? That may mean they'll tell you if they like school or not, or they'll tell you how long they were in school. They'll tell you why they left, or why they don't want to go back, right? Tell me more from Greece, right? I love that, Carrie. Exactly. Tell me more, right? Okay, let's go to number 2. The great thing to kind of use when you're going from closed to open is understanding what information are you really asking about, right? Like what information do you need? So for number 2, how many cigarettes do you smoke per day? What information are we actually asking? What do we really want to know here?
If they have like a substance dependence or abuse.
So is this open or closed, number 2?
Closed.
Closed. How do we want to open this up?
Maybe asking them, when do they feel the need to smoke and why?
That's a good one. Yeah, that's a good one. That's a really good one. Okay. All right, let's move on to number 3. No, let's keep going. Number 4. In the last week, how many alcoholic drinks have you had? Is that open or closed? Closed, yep. Because they could be like 1, 2, none, right? You don't get no information. What information do we really want out of this question? What information are we looking for?
We're looking for them to describe their drinking habits.
Mm-hmm. So how do we open this one up?
Can you tell me more about, or when in the day do you feel the need to have a drink or drink more?
That's a good one, right? Because you want to know, you're asking, like, is it a time of day, right? Like, when do you feel like you need to drink more? And it could be like, when I wake up and then I realize that, like, my wife is still gone because she passed away, right? Like, you could get some information out of that. Let's see. What about number 9? What has been your experience? That's not right. With doctors in the past? Is this open or closed? We got a couple of both. Does anyone, so we have a couple people who said open, a couple people said closed. Does anyone want to tell us why they feel it's one or the other?
I think it could be both. Because if it's a person who's comfortable with and more open, they would tell you why it's positive or negative experience, but it could be closed if a person's not comfortable or you haven't built rapport, and they would just say good or bad, and it would end there.
Right, because the answer could be good, right? They could just say good. Or they could say, well, my last doctor didn't really listen to me and it made me feel some type of way because I had a lot of stuff going on and they weren't really trying to hear me out. So you're right, this one could be either. It could be opened up a little bit more if you think about what information you're wanting to hear. So what information are we looking for in this question?
I think it's like you're looking for someone to like describe an experience. So maybe instead of saying like what has been your experience with doctors in the past, you could say like, could you describe your experience with doctors in the past?
That completely opens it all the way up, right? That's a good one. Okay, so that was a good couple of examples. We'll start back with the PowerPoint. So does everybody feel like they understand the difference between open and closed? Head nods, yes. Okay. So the most important thing about if you feel like your question is closed, think about what information you need, right? Because then that's how you open it up. The next skill is affirmations. So affirmations are statements about somebody's trait, a character trait that they have. Okay, it's different from a compliment. And it's different because a compliment is usually opinion based. Oh, your hair looks so nice today. Well, it looked nice yesterday. You didn't say nothing, right? Like we don't want to do that with clients because it's opinion based, right? So our view of their hair today or our view of their outfit today, right? But an affirmation is saying something like, you've been through so much and you still show up to our meetings every day. That's just great. right? Because it talks about the client's determination, and it talks about, it highlights that they have just been through a lot, right? And they're still moving forward, still showing up, because that's in and of itself is huge. So we have another activity. I'll need the chat. So if everybody can think of a word between a number between 1 and 20. Yeah, so if everybody can think of a number, put it in the chat between 1 and 20. I've already picked my number, so I'm gonna write it down. Okay. I think that might be everybody. Almost. Okay. So lucky people. This is going to be a good one. Okay. So Reynard, am I saying that right? Oh. And Shimel H. So you two are our brave volunteers. Thank you. So the activity is going to be this, and in really using affirmations. Think about a client that, one day really hurt your feelings, or, is a client that sometimes you have to like really prepare yourself to see. Think about that client. Go back to, the last meeting where, they were upset with you or whatever, and think of one positive word to describe them. And then now say that into an affirmation for the group, or type it, that's fine too. So you're thinking of a client that, is sometimes it's just really hard to like work with them. Maybe they bring up some like feelings for yourself. Maybe they yell at you, whatever that may be. Think of one positive word to describe them and state that and make that into an affirmation. So you can type it or you can unmute yourself. Yeah, you can use any client from now, before, whenever. What about Shimel? Am I saying that right?
Hi, yeah, it's Shimel.
Shimel, okay.
Sorry.
It's
I was
okay.
trying to think of a word.
Okay.
I would say resilient, even though, I would say, I guess, I see that you're, you're so brave through all of this, and sometimes, things get very difficult for you, but I see that you're persevering through all of this. I don't know what that word, I guess perseverance would be the right word.
Yeah. Okay. That was a good one.
And I'm just going to use one where I had a former client where she tried to assault me, but I understood she was on her off her mental health medication. But after I got her to calm down and got her assistance, I told her she was amazing.
Okay. Was that they had us do that when I first got trained, and it was, for me, it was a little hard, right? Because those clients that like maybe hurt your feelings, because that's normal to have those reactions, or clients that maybe like remind you of a relationship that you never wanted to deal with again, or anything like that. Like that, for me at least, it was hard to like go through that. But I think our clients deserve us to do that work, so that even the clients that get kicked out of, drop-in centers, or, we have to keep our meetings short with them because they just get really, really loud or whatever that is. that even our folks that are labeled challenging, right? Like we still need to do the work to affirm their character traits, because all of our clients that continue to show up and continue to call and be upset with us and all that stuff, they're still, right? They're still persevering, they're still showing up. And that is something that we need to continually acknowledge, because that is like a version of change talk, right? Like they still show up, they still call you. That's something that we need to definitely acknowledge. Okay, so there's a tip sheet that I have that Carrie will send to you. We're not going to do that one because I just changed the activity this time. So right, they reinforce client strengths and their abilities. Does this make sense to everybody? Y'all want to do a little bit more practice? It's up to y'all. We have 2 full hours. Yeah. So the biggest thing about compliment versus affirmation is that the affirmation is always going to be about a character trait. And you're going to focus on that. Usually you don't even say like I or me. It's just about the client and their character. Compliments are always opinion based, and they come off usually that way. So those are the biggest difference. Like the affirmations, you usually don't say I. It's always about a character trait. They have to be genuine too. So, make sure that whatever, when you're using the affirmation, your tone is genuine too, because clients can pick up on that too. Okay. So we're going to do some practice. Now we have 2 examples in here, and I'm going to preface it as saying that these look very stereotypical, right? Like this is a client that we would have seen, and they would have checked off all of these things because it was a majority in that time frame, or this is something that it's a part of, like a huge part of the community. What I'm not saying is this is not true for everybody, right? But I want us to be clear that in these communities, there are fluctuations between folks' identities, and everybody's not going to choose or hit all of these points. But for the sake of the example and for practice, I wanted to be clear that there are parts of communities that this will not work with. So I just will preface that because they are a little very much like, so this is a scenario. Take yourself back to the 1980s. You're living in South LA, South Central LA. There was huge crack epidemic then. Many Black families were torn apart, right? Kids were taken. That's a huge escalation of like when DCFS just became known as like the people who take kids. Family members who were using disappeared for months. And that person who was using was usually full of shame and guilt, trauma, and families were divided with that pain for generations. So you're a case manager, that's where your client is coming from, right? So now we're back in 2021, you're a case manager and you're working with a client that started using then and has been using on and off since then. So you ask them an open-ended question about the pros and cons of using, which is a great way to verbalize things that they do and don't like about this behavior. So one of the basic questions you ask, like, well, why do you use? What do you like about it, right? Because if people didn't like it, they wouldn't do it. And it normalizes that, like, you can tell me that. I'm not going to judge you for that. So it's a great way to open that door, but this client does not like that question and he's upset that you asked him what the good parts of using crack is. So what do you say? Anybody? No right or wrong answer. Just how do you think you would repair this relationship in the moment?
I think I would start by validating if they feel upset about me asking that. And just kind of go over the aspect of like coping mechanisms, like that there's sometimes we just use what we can, and in that moment that's what they were using, and maybe what kinds of feelings they were trying to or their environment, just to identify the reason why they used, rather than that protected them, or maybe took bad things out of reality in the time they were using. And yeah, so maybe just reframe it.
That's a good one, right? So you want to validate that the question made them upset, which is fine, and then reframe it, because you still want to understand what the question is saying, but you can always reframe it. Yes, I think that's a great answer. You wanted, I put this one and another practice question in here just to be sure that we're being mindful that you may start off with, well, why do you use, instead of what are the good reasons why you use, right? Because knowing, you want to take into consideration what the client, where they come from, what was going on around that time, so that you're not saying things that might offend them in this way. And this is one of my clients that I had to be like, oh, okay, let me say it differently. So this is like an actual real scenario. Okay. So the next skill is reflective listening. Reflective listening is exactly what it means, right? You're for reflecting back what you just listened to. You're going to always use a curious lens, what I mentioned a little while ago, and then it's rather a check-in than assuming that you understand, right? So okay, well let me just tell you how I heard this. Let me know if I understood that right. You always want to be like, if the client is talking and you're reflecting back to them, you always want to allow them to correct you, because they may be like, no, that's not what I meant. I meant it this way. And then you get more information and the conversation continues. You never want to repeat what the clients say to you verbatim, because that doesn't mean that you're processing that information. It means that you're able to hear them and say exactly what they said, right? It doesn't mean that you're understanding them in your own kind of process. So need 2 more brave volunteers. I could pick, or somebody can say I'll volunteer. I need 2 though. Anybody?
I'll volunteer.
Thank you, Karen. Appreciate the bravery. Who else?
Come on, guys, one more.
This is a good one. This is a fun one. Y'all like this one, I think. I like it. Anybody? I'm gonna pick on Abigail because she's on my team. Sorry. Okay. So Abigail, you're gonna talk for 30 seconds. You're gonna talk about whatever. And then Karen, you're gonna reflect back what you heard. What you heard from Abigail. Now you use all of these tips, right? So you want to make sure that you're not assuming you understand it. You don't want to say it verbatim, but you're going to reflect back what Abigail told you. Okay. So Abigail, you have to unmute yourself to talk for 30 seconds.
Oh, is there something specific I have to talk about?
Nope, whatever you want to talk about. Last time, I think somebody talked about like their dogs or something, but yeah, it's up to you. Okay. All right, go ahead and start.
Let me think for a bit.
Okay, I'll stop it then. Let me know when you're ready.
Is there like something specific to relate to, or?
No, well, I can give you a topic if you want to make
Okay,
it
that
easier.
helps.
Okay. You could talk about why you like, do you like dogs or cats?
Dogs.
Why you like dogs more than you like cats?
Okay.
All right, all right, ready? Go.
So I don't really have experience with cats. So since when I was a child, I had a dog, and then unfortunately I had to give her away. But I have another dog now. I really enjoy her company. And when when we're feeling down, they always help us with our emotions. To take them to walk, and it's nice. It helps
Okay.
us like.
You're good.
Do I keep talking or?
Yeah, you're good. 30 seconds.
Okay.
All right, Karen, you're on.
Okay,
What did you hear
so
Abigail say?
okay, so you prefer dogs because they give you more attention and stuff. But would you consider getting a cat? Cats are a little bit more independent. But I see what you say. You've always had dogs, but I mean, maybe a cat would be a good idea too, because they're just more independent and they like to take care of themselves.
Okay. Does anybody have feedback for this like scenario? This is non-judgmental space. We're all here to learn. I learn from y'all too. So does anybody have any feedback for our two volunteers? Maybe. Okay, well, I'll give you some feedback. So the thing about like talking, I think Abigail did a really good job about it. Usually they have you talk in these trainings for like 5 minutes. And 5 minutes when you're just talking about nothing is an extremely long time, which is usually how long our clients will talk. You'll look and be like, oh my goodness, we've been sitting here for 15 minutes. So sometimes the more you talk, the harder it is to remember all of that. So you want to be mindful of that too. The other piece on the reflection side is you always want to just capture what they said, right? So you may say it a couple different times and in different ways, but you just want to capture what they said. If that makes sense. I think that was the only activity. Yeah, that was the only activity for that. So for like summary for reflective listening, you can even take notes. I take notes when clients talk, and I let them know I'm taking notes just so I can remember what we're talking about. And then you could do it at the middle, you could do it at the end. Okay, so let's go over a couple of things we talked about just so I know like this is what you mean by that, right? So you said this is how you feel about it. You were kind of unsure about this. You didn't really like that, but you really like this. You can always make a list and just let clients know. I want to make sure I keep up and I don't forget anything. Okay, so the last skill, oh no, another little stop sign person. So this training looks like, oh yeah, this is great. Like you're just going to go back to clients and ask them open-ended questions, and they're going to want to change and they're going to talk about change, but communication isn't always that easy, right? Like it just doesn't happen that way. So what things do y'all think may block us? What makes communication difficult?
Well, I feel like communication can't start until there's trust built up between individuals.
That's a good one. Thank you. Really
I think also like making sure our personal trauma or like codependency doesn't like, I guess, like interact in that situation. So maybe like we want to talk about like, we wish we had a magic wand and we could like fix all this, whatever it is that they want to change, but of course it has to be person-centered and whatever like they want to change with their goals. And we just, like you said earlier, like meet them where they're at.
Yes, that is a good one too. Anybody else? What do y'all think could maybe like block communication going smoothly.
I think biases can also block communication, whether it's coming from us or them. I can sometimes, I've experienced in the past where, I mean, you know, it just depends the different kinds of prejudices and biases they have as a person and their backgrounds and things like that.
That's a good one too. Thank you for that. Okay, so I also made a list, pretty long list. So ordering, right? Telling people this is what you need to do, blah, 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 all that stuff. Making suggestions, because, you know, in the stages of change and in the spirit of MI, it says that the client gets to tell us what they want. Persuading with logic, well, that doesn't make sense. This does. It makes sense to us, but that's how our mind conceptualizes things. Their logic is different from our logic. How things fit together to them, like what their logic is for that, is gonna be different to us. Arguing with people or arguing with clients, lecturing them, you know, well, you say you was gonna stop doing that and you kept doing it. Don't nobody want to hear that, you know, like that's not how you partner with a client, you know, that's not how that works. Criticizing them, right? So if they go from, and speaking of the stages of change, if they go from like action back to like not wanting to change, that's fine, right? Like that's fine. They can do that. Blaming folks, lecturing again, because that's huge. I put it on there just to double check that everybody got it again second time. Judging. I think that's the harder part about when you talk to clients about substance use, is that they could, you know, year after year, I bet so they have probably experienced someone in their life judging their choice. And that's not something we want to do. We want to create a judgmental space for them. And then choosing sides, right? So well, you said you wanted to do this, so we got to go that way. No, they can go back and forth. It's all up to them. And then like labeling as well. And if there's like a premature focus. So if a client talks about in the beginning, you know, not wanting to smoke cigarettes, wanting to save money and not eat out so much. And then they talk about something else. If we focus into that second thing, but don't allow the client to be like, well, actually, the cigarettes really mess with my heart and my lungs, and my doctors like really wanted me to focus on that. And I think that's most important, right? We have to allow that to play out, because if we focus too soon, then we don't allow the client to do that process and be like, this is actually most important to me. And then anything else where we're perceived that we're the experts, right? We want to acknowledge that in our relationships with clients, there's going to be a power imbalance. Even if we do our best to meet close where they're at, we're the case managers, right? Or we're the clinicians. So those titles alone create this power imbalance, right? So if we're in a session with the client and it's perceived that we're the experts, we got to walk way away from that. We got to walk way away from that part. Because we're not, they are. They know their lives much better than we ever will. So the last skill is summarize. And summarizing it's almost similar to reflective. There's a couple of differences. So it's like a wrap up of the conversation that you had with the client. This can be, you know, maybe after you're 30 minutes in and y'all have talked about a lot and you want to make sure that you understand it. So you like summarize it. Maybe you could use it also when you're trying to like wrap up a session, when it's like an hour and you're like, oh, I think I have to go now. Or you can also use it when you're trying to like break up a topic, right? So they start with talking about smoking cigarettes and then they move into something else. Before y'all dive into that second thing, you can summarize that first conversation, the first part of the conversation. You want to avoid adding your interpretations, and that's the difference between summarizing and reflective, right? Summarizing is straight, this is this, that is that, this is that, right? Reflective listening is like, this is how I understood it. this is my interpretation of what you're saying. And then you want to always ask for confirmation at the end. So we talked about all these 5 things. Did I miss anything? Did I leave anything out? You always want to ask for confirmation. And then you don't want to add any new information with the summary. And that's because the purpose of it is to go somewhere else, right? So either you're leaving, there's like a different topic you want to get to. So you don't want to add, because then you can't move away from whatever you're doing. And then you want to end the summary with a plan. So, we talked a lot about you not understanding your doctor's concerns about smoking cigarettes. And so I'm going to reach out to the doctor and try to understand, get him to explain to me why you shouldn't smoke. And then I'll, in a week when we meet, I'll tell you what they said, right? You want to end it with a plan. Okay. So another practice round, same disclaimer as before, that I wanted to be specific to what type of MI skill would not work with a certain type of population. This is not to say that this is a representation of any person or community, but I'm just trying to get you all to understand that we have to be mindful about the skills that we use, because we can't, like, everything doesn't work with everybody. So this round 2 is you are a cisgender woman meeting with a cisgender Latino male that is older than you. His background is that he was socialized into a patriarchal machismo gender role. So that was what he was socialized into. You are attempting to end the conversation. So you use that summary skill to wrap up the hour-long session. This client tells you that as a woman, you can't end this conversation until he's ready for it to end. What do you say?
Well, I would definitely just remind him that, I'm there to help him. I'm not there to question anybody's like machismo or anything, but just try to reiterate,
Yeah, like your role, right? That's what you mean? Yeah. Yeah, I think a good way to respond is going back to, okay, well, this is my role. This is what you can expect from me, right? I'm not trying to rush you. We kind of wrapped up. Definitely acknowledge that you didn't mean to disrespect anybody. You'll see this come out in a lot of different ways. Like, I had one of my Black female clients say, well, why'd you say it that way? You shouldn't have said it that way, right? When we accidentally don't realize that what the effect that our words can have on people, this is really like the important part, right? You can always go back to something like, well, okay, well, when I need to wrap up, what makes sense for you? Like, how do you want to do that next time? And it'll allow your client to be like, okay, well, this feels better to me. This is what I would like you to do. And then you still saying that you have to leave, because you do have to leave. But you want to just be mindful that not all of these skills match with everybody, and being open to correcting that is like the most important part, right? Well, I don't like that you said that way. I don't want to make a list. I don't want to do a pros and cons list. Okay, let's try something else, right? Like, just be open that these skills, you gotta like tease them out and figure out different ways to like ask them, because everybody's gonna react to it differently. Okay. So just to kind of wrap up for like what MI kind of connects with in terms of cultural relevancy, is that we should always continue to just be really critical about how all these things interact, right? How all of the isms, sexism, racism, ableism, ageism, all of that interacts with the evidence-based practice that was created in the early 1980s, how discrimination and power in our relationships with our clients also interact with these things, interact together too. Okay, so just kind of wrapping up the training. So there's those 4 main components that you'll get the PowerPoint to kind of go over. The skills that we talked about: open-ended questions, affirmations, reflective listening, summarizing, really embodying that clients are the experts and we can understand them by understanding, we can support them by understanding their motivation. Any questions? And then I also have a reference page because this is somebody else's book. So, I don't steal ideas. Any questions? Does anybody have?
So I have a question. Like you said, if they was just like, well, I don't why you looking like that? Why you say it like that? And I don't want to do it like that. And it's just, I don't. So can we just, well, what works for you? What you want to do? Mm-hmm. Is that an approach? Well, what's your best way to figure this out? What you want to do?
That's perfect, right? Because you put the client right back in the driver's seat, right? And be like, okay, let's toss this out. I had a whole plan. It's not working. What do you want to do? Right? It puts them right back in the driver's seat as they should be, right? And it also reminds us that we come in with a plan. Like yesterday, I went to do a housing application with the client. Housing applications are really long. They're 50 pages. She wasn't there. She wanted me to go over every detail of that application. So we got through 3 pages yesterday. So I had to throw away what I was like, oh, I'm about to finish this application. We're going to be done. And she was like, no, I want to know exactly what I'm signing. And I want you to explain every part of it. And I have questions at every line. So I had to throw away what I thought was going to happen and be like, okay, here we go. Mm-hmm. There we go. Okay. So we got through 3 pages yesterday. Yeah. Any other questions?
What sort of questions would you be asking of a client that doesn't appear to be taking any sort of initiative in their plan? So say what if they say to you, whatever works best or whatever you think is best, and despite all your attempts to get them to take charge?
I have a couple of thoughts, but I'm gonna open up to the group and see what do you all think. And then I'm pretty sure you'll find the answers in this space. So what do y'all think?
I think giving options is always a good idea. So maybe you do come up with a couple different plans and you're still allowing them to take initiative because they're still going to be choosing which plan they would like.
Mm-hmm. That's perfect.
I also use the miracle question, which doesn't work with everyone, but it's useful if they are ready for change. The miracle question is usually, if you could wave a magic wand and the next day this problem was solved, what would be different? How would your day look like? How would that impact your relationships, your housing? And then that kind of helps them explore what their motivations might be.
That's a great one too. Okay. Any other questions? I think I'll pause or stop the recording.